Great. Thank you so much. And thank you so much, everyone, for coming to the presentation today. I wish I could be there with you in person in Frankfurt. I apologize, I'm not able to make it for this trip, but I did Google the weather in Frankfurt, and it sounds like it's a bit of a rainy day today. So I'm really hoping that you all stay dry and that the weather improves for you as well, and you get a few good days, maybe on the weekend. Thank you so much for the introduction. I'm Maureen Abbott with the Mental Health Commission of Canada. And the team that I focus on focuses specifically on e-mental health. And I know there's people in the room from all around the world. So I'll tell you a bit about what the Mental Health Commission of Canada does. We have a mandate from the federal government in Canada to focus on mental health programming, resources, and best practices for mental health in Canada. And we do everything with our collaborators, both in Canada as well as collaborators internationally as well. And in terms of our focus today. So, we're going to be focusing specifically on e mental health. And I'm going to run through some best practices for e mental health, as well as some resources for you if you're curious or interested in e mental health. I think that one of the things that really strikes me with the digital health community around the globe is that there's so much intersections between health, physical health, and e-mental health, as well as other areas as well. So I think a lot of the content will hopefully really resonate you as well, even if you're not specifically in e-mental health, but also in the larger digital health world. So, in terms of what is e-mental health, our definition is broad. So, knowing there's many different types of e-mental health services. So, for us, it's not just apps or artificial intelligence, but also text reminders for appointments and telehealth, right to the other end of the spectrum with virtual reality. And they range from lower intensity services for mental health care to higher intensity services. So we are seeing that there are more and more e-mental health solutions out there that are starting to deal with more complex and persistent issues such as suicidal ideation. And some people may prefer to use in person services, and others prefer to use e mental health services, but both are just fine. And the key is really having that flexibility. And what we hear from people using the services is that they really like the anonymity of using an e mental health service. And a lot of people find there's a lot of stigma with logging into an in person service. And sometimes logging in online helps to actually reduce that stigma for them, as well as the flexibility. So if you're in a crisis in the middle of the night and there are no in person services open, there is an option of logging in through a mental health app and being able to access a peer support group or services that way. And we've heard that from some people, it's literally saved their life having access to those services. And these are projects that we're currently working on at the Mental Health Commission. I'm going to focus on the first three today. So, our app work, as well as our email health strategy for Canada, which we just launched last Friday, as well as artificial intelligence use with mental health. But I will provide a slide at the end that shares access to all of our resources. So please stay tuned for that. I have some QR codes coming up. So also feel free to take out your phone if you would like to access any of the resources. So we know that people are very interested in using e-mental health services in general, specifically apps for their mental health. And we also know that people are keen to choose digital health solutions overall, and especially youth, actually. And there are large numbers of e-mental health solutions out there. And Canada Health Infoway completed a 2021 survey with Canadians, and in the results, 73% of people said that e-mental health has helped them deal with a moment of crisis or distress that would have resulted in physical harm or suicide. And 63% said they would not have sought care if virtual options were not available. So these numbers are quite staggering. And the case for virtual options, and especially apps as well, is very strong in Canada. So we know that people are keen to choose e-mental health solutions overall, but there is an issue that I want to address around this intersection between trust, transparency, and quality. So specifically with apps, we know there's no real way of measuring the quality of apps, I guess, a few years back. And that was the real issue we were faced with. We knew there were some great apps out there, but we also knew there were some apps that were sharing people's marketing data as well as sharing the wrong crisis line number on their app. So we desperately needed a way in Canada to be able to assess the quality and safety of mental health apps. And unfortunately, user ratings and downloads in the App Store did not correlate to quality. We already knew this, but this is an article that is hot off the press from March as well, from the spring. But we also know that when people feel that they can trust a digital mental health solution, they're more likely to want to use it. So, with funding from Health Canada, we started this journey about 4 years ago to develop standards for mental health apps in Canada. And throughout this process, we have been working with the Organization for the Review of Care and Health Apps. ORCA, which is an organization in the UK. You might know them as well since they're in 13 jurisdictions around the world, including Europe. And they work on health standards and setting up similar mental health standards for apps as well. So what we really liked is that ORCA has a base set of standards that takes a systems approach. But with each new jurisdiction, you really have to validate that content to make sure it's applicable for the jurisdiction as well. So that's what we did with the Canadian population specifically. So we engaged about 200 of our stakeholders, and that included those with lived and living experience. And I do want to share that that is a very important part of the work that we do, is engaging with those with lived and living experience. We also worked with app developers, researchers, and health executives. We completed a public review, and we were really looking at what is the content that was needed specifically for Canada. So this is a QR code where you can access our app assessment framework. I will say that it does not include medical devices. So medical devices go through Health Canada, which is a different process. And in terms of the assessment framework, it begins with a glossary of terms, followed by an app overview. It is 7 different areas of focus. All standards draw in relevant technical standards and incorporate a scientific approach. And it's also based on the level of the app. So apps are assessed on different tiers. For example, if there's a wellness app, that would cover a different intensity of services than an app that deals with suicidal ideation. Also, an app that deals with AI would also cover a different series than apps that don't. So one item I wanted to highlight here is this standard on cultural safety, social responsibility, and equity. So this was really new content that wasn't really done previously in other jurisdictions. But specifically for the Canadian context, the population was really looking for apps to be able to provide Indigenous data security and privacy that is specific to the Indigenous population, since we have a long history of that in Canada and the misuse, as well as gender equity and representation from the BIPOC community, as well as usability and accessibility, and incorporating lived experience involvement right into the app development and through to the testing. So that is something that we did incorporate into our framework. And a recent publication we worked on from March, this is actually part of the research that we did before we developed the app assessment framework. We saw that most assessment frameworks unfortunately don't include a component for cultural safety and equity. So this is something that we encourage in the future. And in terms of legislation for the assessment framework, we don't have a national assessment process yet for mental health apps. We are working on that for next year. But in the meantime, we're taking a provincial approach. So we have a lot of provinces and territories that were interested in app libraries for the region. So we turned our PDF framework that you'll see on our website into an online review engine. And we've been working with provinces and territories to review apps based on the assessment framework. And then these provinces and territories can post this on their website so their residents have access to safe, quality, and effective mental health apps. I'm going to turn now to the e-mental health strategy for Canada. So the e-mental health community in Canada, and we also had input from around the world, but especially from Canada, was really calling for a guiding SAR document to highlight priorities and future directions and for the development of e-mental health in Canada. So with funding from Health Canada, again, we started this three-phased approach for an e-mental health strategy for Canada. We started with a literature review and then the development of an advisory committee. And it's important to mention that half of the members of the advisory committee were made up of those with lived and living experience, which truly shaped the strategy in a meaningful way. And I certainly encourage you, all of those in the room, to consider meaningful ways to engage the end user as well in your product. And then finally, we also sought validation from the wider collaborator community in Canada and also the world. And there are 6 priorities that were identified in the e-mental health strategy for Canada. And these are really priorities looking to the planning and implementing and the future of e-mental health services in Canada. And these priorities included embedding inclusion, diversity, equity, and accessibility into all principles of e-mental health development and delivery, as well as supporting the workforce in e-mental health. Because often we expect the workforce to be able to just pick up e-mental health and digital solutions automatically without any training. But unfortunately, that is not how it works. And we really strongly encourage the workforce to be able to engage in training and to be able to build that. This also builds trust and capacity with the workforce and knowledge as well, so that they feel better equipped to be able to take on changing over to a digital solution as well. And there's also 12 recommendations in the e-mental health strategy. And these recommendations map to the 6 priority areas as well. And these are recommendations for actionable solutions for e-mental health in Canada. So this recommendation includes a national mental health app library, and we're already getting started on that work, as I mentioned, as well as guidelines for AI that are specific to Canada, as well as specific system navigation within Canada. So I'm so pleased to share that the e-mental health strategy for Canada is now live in English and French on our Mental Health Commission of Canada website. So please review, share, and also feel free to use this information if it is also applicable to the e-mental health or digital health planning in your context as well. And lastly, I'll share a bit about our work on artificial intelligence, and then I would love to open it up for questions. We have been doing some research in the domain of AI and mental health for quite a while now. We do have some reports that we published, I think they were in 2021, and we do engage in podcasts and other areas where we provide a bit of a pulse on the trends and uses of AI and mental health in Canada, as well as commenting on the need for standards and safeguards in this area as well. So one of the projects that we're working on now is guidelines for artificial intelligence specific to mental health, because we do have pending legislation in Canada that we're closely following that would follow legislation at the federal level, but we don't necessarily have anything that's specific to mental health in terms of AI. And some of the areas that we're looking at that are more emphasized, I would say, in AI and mental health is a human-centered approach to technology, as well as reducing bias in the system, as well as transparency. So ensuring that people understand that this is an AI device that they're engaging with and not a real person. And I would love to give you access to all of these resources as well. Please feel free to navigate to the QR codes where you can see the eMental Health webpage. And I also included the Step Care 2.0 webpage. And Step Care 2.0 is a systems approach to eMental Health services as well as mental health services in a specific area. And it takes a stepped approach to care where it recognizes the care can be stepped up or down based on preference and need. And that is also worth a read as well if you are interested. So thank you so much for listening. And do you have any questions?
Thank you very much, Maureen.